Which of the following autoantibodies is most likely to be found in this patient's serum? So, a 28-year-old woman presents to a dermatologist with an intensely itching rash on her elbows, knees, and buttocks. The rash consists of small vesicle papules. The skin biopsy reveals a subepidermal vesicles with neutrophils at the tips of the dermal papillae. Which of the following antibodies is seen? So it's not any of the desmogleins. I know that one because those are related with like the blistering, and this is not a blister. What I think that it's a antihistone because I remember seeing antihistone with like one with rashes,
Okay.
I believe.
Okay, let's talk about this. This is actually anti-endometrial here. Okay, so we'll talk about why. So it's usually this looks like dermatitis herpetiformis, right? Which is
Mhm.
celiac disease. Okay, so it's a kind of a tricky question because you had to first know that it's dermatitis herpetiformis, and the reason why is because these small vesicles and papules that look like herpes, but it's not because they're neutrophils at the tip of the papilla dermae, right? And the reason why they call it dermatitis herpetiformis is because it looks like herpes, but not because of the vesicles, and that's going to be associated with celiac disease. And celiac disease has anti-endometrial antibody. But if you look at kind of the antihistone, that's more for drug-induced lupus. Okay.
Mhm.
Anti-DNA is also systemic SLE, right? Anti-desmoglein 3, kind of like you said, right? Pemphigus vulgaris, right? Usually deeper epidermis between you get these flaccid blisters that kind of pop and erode and inside your mouth. Anti-desmoglein 1 is another pemphigus, right? Blister disorder, superficial dermis, and flaccid blisters and erosion also. Okay, so best answer here is first you had to recognize, right, that she has these vesicles. And if you're thinking vesicles, you're like, why does it look like herpes? What can be associated or look like herpes? That's going to be that dermatitis herpetiformis. And then what is that associated with? And that's associated with
Okay.
celiacs. So the best answer is going to be anti-endometrial. So
Gotcha.